And we are live. It's Dr. J here. Today's video is going to be on the coronavirus, what to do, and how to protect yourself against viruses in general. So first off, viruses typically don't live long when they live long once they are detached from the host, so to speak, typically 24 to 48 hours, right? So the main way that you're going to get sick from a viral infection is someone's going to give it to you. So respiratory issues, usually respiratory droplets, sneezing, those kind of things are going to be a major vector. And the number two, not washing hands. So if you can kind of control those two vectors, that's going to be important. Now, what's the survival rate of coronavirus? Typically with a lot of viruses, especially like the flu, it's going to be 98% survival. All right. So then who are the 2%? It's going to be extreme young, extreme old, extreme immunocompromised people. So first thing, if you're in that immunocompromised area, quarantine's going to be number one, hand washing around anyone, as well as potential mask, right? Those are going to be the three big things that you can do is quarantine, hand washing, mask. Now, that's for like the extreme immunocompromised. Number two, prevention's going to be number one thing you can do. So supporting your immune system is going to be the first thing. That's going to be keeping refined sugar, processed carbohydrates out of your diet. That's going to decrease your macrophage activation, make it harder for you to fight the immune system. Number two is keeping nutrients like vitamin C up, keeping vitamin D up. We could also be on like a really good medicinal based mushroom like a reishi or a cordyceps or maitake. That's going to increase your natural killer cells. And not to mention reishi or Ganoderma is actually going to deactivate a lot of viruses. So I like that. I like the reishi because it's going to really bump up your immune response and it's going to also help deactivate viruses. And then I would say on top of that, we could even do astragalus, echinacea, golden seal. There are different herbal complexes out there. I have one called them, Supreme that has a bunch of those in it. You can get some of the herbs singularly. Good vitamin C, good vitamin D, and then we can pick either a combo herbal product like Amino Supreme, or you can do individual herbs like astragalus, do the full root. Echinacea, do the full root. Also, we can do silver. Now, silver is unique because we can actually do that nebulized as well. It's pretty controversial. You can go online and Google. There's a couple of case studies out there showing significant improvement with cystic fibrosis, different bacterial infections, different viral infections. So it's very helpful because you can nebulize silver, get it into your lungs, and it can have a direct contact with the virus. And remember, most of the viruses, they don't really kill. It's usually the pneumonia, the post-pneumonia that comes in after the fact that causes a lot of problems on the lungs and on the kidneys. And a handful of people that have died in China, I think it's the Wuhan area, they were previous smokers. So previous lung weakness is going to put you more at susceptibility. So again, silver is going to be very helpful topically to get it in the lungs. There are complications with silver like argyria. That's only going to be crappy silver. If you're buying high quality silver that's kind of a nanoparticle size, 10, 15 part per million or less, that's really small, you'll be able to pee it out. It won't accumulate in your cells. But go see your doctor on that. This is just education purposes. Go see your doctor, talk to him about it. The silver, nebulized silver is very controversial, but I've seen it work and it's been very therapeutic. There's a lot of Facebook pages about it where people talk about their experiences clinically, and it's very beneficial. You can do it preventative as well as acutely. Now, we can also use glutathione acutely as well. So we can get special nebulized glutathione. There's lots of studies on glutathione. Nebulized can be amazing because it helps with oxidative stress. It helps with inflammation. So if we have any lung distress or we have any pneumonia brewing, it's going to really help calm down and attenuate the inflammation response. So I use the Philips InnoSpire nebulizer. That's helpful. Omron also makes one. We'll put a link down below where to find those, and how, I've got to do a video on how to do a nebulizer, how to make it. Essentially, you get your nebulizer, you get the nebulized saline solution packets, usually about 5 mLs, and then you take it, open the nebulizer up, you put the mLs of the saline solution in there. Usually you add 1 capsule of reduced glutathione. We'll put the link for that. You have to have a special glutathione that's designed to be nebulized. You add it to it, it dissolves, and then you nebulize for 4 minutes. You inhale it, and it's done. That's simple, but very helpful because it helps with oxidative stress, helps with inflammation. It's a tripeptide, totally natural. Your lungs need glutathione anyway, and you're helping to deliver it acutely at much, much higher levels. When you look at blood levels of glutathione, especially in the lung area, just taking it orally, you won't get the same level of a therapeutic dose, so to speak. So silver is very helpful from a nebulized standpoint. Glutathione is very helpful for a nebulized standpoint. And then we mentioned astragalus, we mentioned echinacea roots, we mentioned andrographis, we mentioned medicinal mushrooms, love reishi because of the deactivating viral effects. Vitamin C, you can dose up to bowel tolerance. So if you start to have loose stools, just back off a little bit till your stools get solid, but that's going to be phenomenal to help with your immune system. And of course, lots of sleep, get an extra hour or two of sleep, 8-10 hours a night. Lots of water, cut all the refined sugar out, cut all the alcohol out. And if you're immunocompromised, hand washing with anyone that's around you and or mask. And with the mask, there's some masks that are on the market that actually line with silver, which is nice. So if you breathe out, the silver has a way of killing the virus when you breathe it out. So you can get some of the silver-laced masks that are on the market, which are pretty cool too. So I hope that helps. First thing is prevention. Prevention is going to include, if you're immunocompromised, hand washing, mask, quarantine. The other level of prevention is keeping sugar, alcohol, refined grains, processed carbohydrates, healthy proteins, healthy fats, bone broth, soups, supplementation, vitamin C, vitamin D, astragalus, Ganoderma lucidum or reishi mushroom. You could do silver nebulized, glutathione nebulized. So there's a lot of good options, and we tier it up differently. Okay, hope that helps. Again, I'm in the trenches clinically, so I see these things, they work. Some things are controversial with like the silver, some aren't. So do your homework on it, talk to your doctor. I recommend getting a plan of attack ahead of time. So if you do get sick or you do have an issue, you're on top of it. Most of the time, the incubation period's like usually 5 to 7 days, meaning you're not going to have symptoms for about 7 days after you get the infection to begin with. So once you start having symptoms, it means you've probably already had the infection for about a week or so. So just be mindful of that. It's better to have your medicine cabinet stocked with all the nutrients and herbs and immuno support you need. So when you're ready, you got it. All right, hope that's helpful, y'all. Feel free to send this to families and friends that need the support. Again, 98% survival rate. So it's going to be the immunocompromised people that really have, the worst to worry about. And again, if you are starting to get sick and you think that pneumonia is coming in, make sure you see a doctor, get on the antibiotics ASAP if you need it. Hopefully the things I'm telling you will prevent you from even having to go that direction. So we'll just have to keep an eye on that. All right, hope that's helpful for you. Would garlic be beneficial for viruses? Yes, garlic would be very beneficial. You could always add that in. It's going to have really good antibacterial effects as well. Again, not really, probably some antiviral, but definitely more antibacterial. Is colloidal silver as good as the silver you mentioned? I like nano silver. My GI Clear 3 is a nano silver. I like that. It's a 15 part per million. Sovereign silver makes a good one at around 10 part per million. That works really good too. And then either IVC or liposomal if you can't afford the IVC. Yeah, so I think you mean intravenous vitamin C. Is that what you're referring to? Or liposomal vitamin C? Yeah, oil of oregano could also be used as well. Just be mindful with oil of oregano. You want to also add in probiotics either now or later because it will have an impact on the gut bacteria. But oil of oregano at high doses is very good as well. I'm not worried about medicinal mushrooms contributing towards candida. That's not an issue for me. A lot of good beneficial effects with medicinal mushrooms. The beta-1,3 glucan, the triterpenes, which actually help deactivate and encapsulate the virus, which is awesome. Remember, viruses can't live more than a day or two outside of a person's body, right? So, quarantine is going to be ideal. Fresh air if we can. All those things are going to be very, very helpful. And if you have access to vitamin D or getting some sun, if you have access to good sunlight this time of year, that's going to be absolutely huge as well. All right, hope that's helpful. Put your comments down below. Let me know what's helped you with viral infections in the past. The corona infection may be a tiny bit more virulent, probably close to what the flu typically is. Most people that die of the flu is going to be elderly and immunocompromised, and most of the time it's going to be a pneumonia-based infection at the end. So don't be afraid to get on antibiotics if we need to, but hopefully we can be on top of it ahead of time. Let me know what you've done, what's worked, what hasn't. Talk to your doctor about these things. Get a plan of attack ahead of time so you're not reacting when you're sick. It's always terrible when you're feel like crap and then you're trying to react and fix everything. Get your plan of attack ahead of time. Hope that help is helpful for y'all. Give me that thumbs up. Give me that like button. Really appreciate it. Hit the share. And you guys have a phenomenal day. Take care. Bye.